UMC has updated its statement on a case of measles at its children's hospital last week. A hospital spokesman said because of HIPAA restrictions, they cannot give any specifications, not even the gender of the person with measles.
Karen McKay has confirmed additional information from several sources, but this is what she heard when the local issues were addressed during a national news conference today, hosted by the Big Cities Health Coalition.
Specifics on the hospital cases will need to be referred back to the hospital.
But here's what we have pieced together from UMC and several other sources. A pregnant woman was screened for measles and admitted to the hospital last Wednesday showing no sign of the illness. But when symptoms began to appear during labor and delivery, she was immediately isolated in a negative pressure room, which keeps the airflow in that room instead of circulating elsewhere. So how could she have measles if they screen patients before they are admitted? Without speaking specifically about this case, Dr. Simbo Ige from Chicago explained this in the news conference.
So it is possible for people to be exposed and not know it, and not know that they were exposed. And this is the thing about measles. So sometimes it's not like they're lying, it's just that they weren't aware, and you can transmit measles even before you're sick.
In the Zoom conference today, Catherine Wells, Director of Health, said this outbreak is prompting health officials to rethink their screening methods. Without referencing UMC, she said this is not the first woman with measles to give birth during this outbreak.
There have been multiple pregnant women throughout this outbreak that have been infected with measles. Yeah, I mean, this is a large outbreak, and it is going to impact, women of childbearing age.
We know at UMC the baby who was delivered from the mother with measles was also placed in isolation. UMC says since the patient had no contact with other patients and their staff is fully immunized against measles, they believe no other person was exposed. However, with the potential of exposure before measles was identified, UMC offered added protection to anyone on that floor if they chose to accept it, meaning an MMR vaccine to those who are old enough to get it, or an immunoglobulin shot to babies under 1 year old. That's basically a high-protein shot to boost their immunity until they are old enough to get the vaccine. At the Zoom conference today, Dr. Ige said she is concerned that some patients are following misinformation on social media and using vitamin A to treat or prevent measles at home.
Vitamin A was not the reason why we got to elimination, it was the vaccination. So if we want to control this, then vaccination is the way to go.
Looking back at last week, a UMC spokesman says they might have taken a different approach with the media on this, but they were more concerned about following CDC standards to ensure the safety of patients, their families, and visitors with HIPAA guidelines in mind. One thing that was emphasized at the Zoom conference today was that any woman who is pregnant or thinking about getting pregnant needs that MMR vaccine.
Women before they get pregnant need to make sure they've been vaccinated so that they're protecting both themselves and that unborn child.
Pregnant women who are vaccinated then provide protection to their newborn for the first 6 months.
And you can tell Karen is feeling a little under the weather. We appreciate her work today. You can